I'm going to go next to Beth Rigby of Sky News.
Thank you, Prime Minister. Just to follow up on Robert's question, on July the 17th, your exact words were that you should be able to review outstanding restrictions and allow a more significant return to normality from November at the earliest, possibly in time for Christmas. Can I just be clear? Are you now saying that without that mass testing regime coming off between then and now, people watching this should accept that they're going to have smaller gatherings of family at Christmas and they're not going to be able to have a big party that perhaps they would have been hoping for? And Professor Whitty, just to ask you, when I asked you a while back about your biggest regret at the beginning of this pandemic, you talked about the importance of mass testing. Now the Director of Testing, Sarah J. Marsh, has apologised to people unable to get a test because of lab processing issues being, at her words, a critical pinch point. How worried are you that the testing system is already under strain before we've even hit the winter?
Okay, I'll hand over to Patrick in a second, but Beth, look, thanks for that. I think the honest answer to your question, it is just too early to say. We've got two big projects that we're backing. The first is the change in public behaviour that we hope to see through the announcements that we're making today, through the rule of six, for the plan to drive down the current increase by changing our behaviour back again by adhering to the rule of six very strictly. That we hope will work. We're also hoping, as I said, that the moonshot approach will work, and that we'll be able to deliver a mass testing, lateral flow type mass testing that will give people the freedom pass, the laissez-passer, the knowledge that they are not infectious and can hang out with other people who are not infectious in a sort of pre-COVID way. Now that's a very ambitious plan, but we're working on it very, very hard and very fast, as you can imagine. We're backing both those horses, and we're backing them flat out. But the thing we need now is for everybody to work together to enforce the rule of six and get the current spike down. But obviously we'll keep the public informed about all the progress we're making. Thanks, Chris. Sorry, forgive me, Chris.
When we started off the first wave of this in the UK, we had low thousands of tests a day. And that really constrained what we could do, and that was made it very difficult for us to do proper planning. I think what you saw at the beginning of this presentation, depressing though in many ways it is we are now in a much better place. We do actually now have a much greater understanding in considerable detail as to what is going on, and we're able to provide testing across the system. That's the glass half full. Glass half empty is clearly at any point there are more things we could do if we had more testing. Now, the biggest gains are near the beginning because you're moving into being able to test people who've got symptoms, healthcare workers where there are outbreaks and so on. But there are still constraints, and that's one of the reasons it's important. As with very, very many other things in the NHS, this is no different, that it's critical that those who do need to be tested, in particular people with symptoms or ones where people have, situations where people have been told to, for a variety of reasons, social care working, for example, get tested. But it is also important that people who really don't have a clear clinical indication currently don't, because we do still have constraints, and I think that's what this is demonstrating. If we get more testing, every significant uplift of testing we get, we can do more things. And one of the things that I hear quite often when I hear kind of debates in the public is people will say, well, can't you test for this and can't you test for that? And the answer is, well, let's get the testing capacity first and then work out what we're going to do with it. And at any given level of capacity, you can do more things that actually open up more parts of the system. And the Prime Minister gave an idea about what you could do if you had a really large, in a sense, huge change in testing, if the technology was there to do that. So I think we have to be honest with ourselves that we're in a much better place than we were, but there are still constraints, and those constraints are not just magically going to disappear, and the demand on testing has increased, outpacing at certain points our increase in testing, and that may happen for a little while, I think.